All right, so I am Will Copel. I'm here with one of my patients who has gone through the CIRS protocol. I'm going to let her talk a little bit about what brought her to me, her symptoms she was having, and any other information she may have.
Yeah, thank you so much. Yeah, so I was super pleased to find someone in states. I'm in Georgia, and that can walk me through this protocol. I have been dealing with health issues for 9 years. I had a significant mold exposure when I was pregnant 9 years ago, and have been experiencing lots of health issues since then. Um, there is a genetic component, and I can trace it in my family tree. So I'm actually getting some family members kind of to become aware and start pursuing it as well. Um, but yeah, I mean, I had lots and lots of alternative practitioners helping me just to get through the day to function. I'd been on like 15 supplements at a time for a number of years. A lot of acupuncture, a lot of nervous system work, all kinds of things, but nothing, even a lot of meditation I used, but nothing resolved the problem until I started on the protocol. And within a couple weeks, like all my symptoms have disappeared.
Awesome.
And I am very, very pleased with the progress. Some of my main issues were sleep. Um, there was a chance that I'd get maybe two good nights sleep in a week, but I would wake up at very bizarre hours, early morning, and just not be able to go back to sleep. And then when it was time to get up, I'd fall asleep, and just very discombobulating for trying to have a regular schedule. And I had done research into circadian rhythms, and I had all these practices, but still nothing resolved it. So now I sleep every night,
Yeah,
all the
so
way through.
one of the key markers we get with the Shoemaker protocol is a MSH. It's a melanocyte stimulating hormone. It's one of the labs we draw on people who are going through the protocol. And people often have low MSH, and that MSH is a neuroregulatory hormone. So it regulates a lot of downstream things. So if a patient has low MSH, they often have sleep problems, chronic pain, gut problems, chronic inflammation, hormonal problems. It can just lead to a lot of stuff. So if I remember correctly, your MSH was low. Let's talk a little bit more about the workup. So, like she was saying, there is a genetic part to this. So one of the other labs I do is a HLA test, which basically is the handoff between the two parts of the immune system. So when people first are exposed to mold, so 9 years ago, when you were exposed to mold, she inhaled the mold spores, and then her innate immune system is the first on call. That creates a lot of inflammation. And then that HLA hands it off to the adaptive immune system, which in most people should turn that inflammation off. But in 25% of the population, they are genetically susceptible to not being able to resolve this inflammation. So that is one of the key tests as well. So the HLA and the MSH, those are key markers that we get in this. So tell us a little bit more about when all this started for you. What happened? What was like your first symptom? How did you find out that it was mold? Kind of expand a little bit about that if you don't mind.
Sure. First symptoms were just feeling weird, just something's not right, some anxiety. Um, I thought that it was related to, well, at first I thought it was like anemia. And so I started taking iron, and that I figured that out pretty quickly that didn't need to do that. Um, and yeah, just had like energy crashes. I would just pass out, basically have to like just this strong compulsion to lay down, couldn't get around it. Had to just lay in the afternoon for an hour or something. Um, anyways, I thought it was related to nursing pregnancy. So I thought, well, when I wean this child, then I'm going to be fine. And I wasn't.
Hmm.
So I was seeing a practitioner who kept telling me, you all are testing, energetically or whatever for mold. Um, and I said, well, what should we do? She said, rip out all your carpet. So we went home and literally the next day pushed all the furniture to the side, ripped all the carpet out. And there had been a plant that we were watering that the water was going down into the floorboard, and there was a big patch of black mold right under the air handler. And so, yeah, from there, um, just trying to, we moved out of the house for a little bit, got it taken care of, but just never, I haven't gotten relief until I started on the medicine.
Yeah, so
So,
basically that immune system was triggered by that mold, and then basically for the next 9 years, that inflammation was just building and building and building because you genetically could not turn that off. So talk to me a little bit more about those 9 years. What all did you experience? What was like the worst symptom you experienced?
probably the scariest was what I thought it was like some kind of seizure like response. It was only when I would wake up and certain situations kind of made it worse. But it was like I would go down and my blood pressure, I knew my blood pressure would get low, but I would go down and I would just feel like I was convulsing. So it's just scary, not knowing what that was about. That's been resolved. My blood pressure is fine. I don't black out anymore. I couldn't drink any alcohol. That was a little bit of a mystery. I kind of stopped for a number of years just from pregnancy and such. But when I thought, oh, I'm doing a little better, I tried like, just half a glass of wine. And the next morning, I literally just completely passed out. I hit my head on the tile. I've broken, and it happened again. After that, I broke a shelf, just completely going down.
Dang.
Um, so that was kind of scary. Um, yeah, I haven't had alcohol since then. Although now, when I finish the protocol, maybe I'll be able to do it again. Memory was an issue. I just
Hmm.
felt like I couldn't remember anything.
Hmm. For
Um,
sure.
there's Alzheimer's, in our family, and so it's kind of like, oh, is this like early onset? But
Hmm.
thankfully, that has improved. My appetite was really weird. If I got close to a meal, it's like my blood sugar wasn't low, but I would just get this like revving, this intense, nervous system revving. And so I'd have to do like meditations before I ate to like calm my body and not have the appetite swings, I guess.
Hmm.
But all of that's gone now. If I feel hungry, I eat and I don't get any kind of weird sensations about it.
Awesome.
What else? Well, those were probably the main things. I
Yeah,
mean,
that's pretty.
if I skipped a meditation, like I could not handle life. I had to meditate at least twice a day
Yeah.
for it's been 5 years I've been
That's
doing
that's
it.
pretty intense, passing out and then memory problems, and I mean that those are some intense symptoms. So for those of you that are watching, so I just kind of wanted to talk about how do we diagnose CIRS. So you the first thing is symptom clusters. So Dr. Richie Shoemaker, he started this protocol about 40 years ago. He was working in a fishing village, and a lot of these fishermen came to him with all these non-specific symptoms, and he basically gave them cholestyramine, which is a binder we use in this protocol. And he found that the fishermen, not only did their diarrhea go away, but a lot of their other symptoms went away. So I just wanted to touch on the symptoms, which you've touched on a little bit, but to actually diagnose CIRS, most people have a few of these symptoms. They are feeling fatigued or weak. We see a lot of brain problems, like you were talking about, memory problems, problem finding your words, concentration problems, problem assimilating new knowledge. A lot of people have a lot of aches, headaches. I hear a lot of people say they're light sensitive. A lot of people have cramps. They're real stiff in the morning. Some people have like unexplained tingling and numbness. A lot of people have shortness of breath, sinus congestion, because this chronic inflammation is just affecting the entire body, every organ system. Other things we see, appetite swings, like you talked about, difficulty regulating your body temperature. A lot of people are very thirsty, so they urinate a lot. We'll do some labs that investigate that aspect of the body system also. A lot of people have red eyes, blurry vision, sweats, mood swings, abdominal pain, diarrhea, disoriented, static shocks, and vertigo. So I threw a lot out there, but basically, if you answer yes to 75 to 80% of those symptoms, then the next thing we do is a visual contrast study, which is a test that's testing the optic nerve. It's basically a test. You can go to survivingmold.com. Dr. Shoemaker has a visual contrast on that website. Basically, it takes about 10 minutes. You cover one eye and look at a shape and match it to four options, but it's looking at the visual contrast. And basically, if you fail that, that tells us you do have hypo or decreased blood flow to your optic nerve, which denotes brain inflammation. So when I first heard about this CIRS mold protocol, I honestly was not convinced. Um, I didn't really know mold could cause this, but after seeing patients like you time and time again, and then they get better relatively quick once we get them on the right binder, I'm definitely a believer, and I know you are too.
Mhm.
So yeah, just diagnosis is those symptoms I talked about, the visual contrast. Basically, if you have those two things, if you fail the visual contrast and have a lot of those symptoms, according to Dr. Shoemaker, it's a 98% chance that you do have chronic inflammatory response syndrome, also known as CIRS. So that's a quick and easy way that you can kind of diagnose yourself before you come and see someone like myself. But once you come and see me, the third thing that we do is we do some blood work. So some of the tests we test is the genetic marker, the HLA, the melanocyte stimulating hormone, and then basically we're testing different points in that immune system to see if you are indeed creating a lot of inflammation. So once we nail the diagnosis down, then we start on the protocol. The first step is making sure you're not living in an environment that makes you sick. So a lot of people get caught up on mold. Mold obviously causes CIRS, but Dr. Shoemaker is coming to realize that actinomyces, which is a bacteria, is actually the number one cause of CIRS. Other things that can cause CIRS is COVID, tick bites, spider bites, really any biotoxin can trigger that inflammation. And once again, if you're genetically susceptible, you can't turn it off. So you'll start having these symptoms that are going on throughout your entire body. So basically, step one, like I said, is making sure you're not living in an environment that's making you sick. And the second step is taking the binder. So, can you talk a little bit about your experience with the binder?
Yeah. So I did the fish oil, high density fish oil prep, and then started taking cholestyramine. And it's been great. I just kind of built up. I started, with once a day, and now I'm taking it 4 times a day. And, it's powdery, it's chalky,
Mm-hmm.
um, but it's doable and super, super easy way to feel better.
Yeah. So kind
And
of
I
that was a
don't,
good point to touch on the fish oil. So we do recommend pre-loading up with fish oils and then taking high doses of omegas throughout this protocol. And the way those fish oils work is those are also decreasing inflammation. We usually recommend you taking those a week or two before starting the binders. And then when you start the binders, the dual action of the fish oils and the binders really bring that inflammation down. So you said it worked pretty quick for you. How quick did it take before you started noticing your symptoms resolving?
um, probably within 3 weeks, I was I wasn't waking up at night anymore.
Okay.
Yeah. So,
Awesome.
I mean, I started at the beginning of December.
Okay.
Now it's January 23rd. So
Okay.
yeah, it's very quick
Yeah.
um, to see the impact.
Hmm. And would you say all your symptoms are resolved, or do you still feel like we still have some work to do?
Well, I checked the visual contrast test and it's not, I still haven't passed that. So, I mean, to me, the improvement is so noticeable. Like, it's great. I want to see what else I can get out of it. And then when I pass the visual contrast test, just be done. So,
Yeah.
because
Yeah.
I've been dealing with this for so long, it's kind of become my normal. So anything good is any improvement is like, wow, this is great. I'll take it.
For sure.
So it's hard
Yeah.
for me to know exactly, how, yeah, just
How good you can get. Yeah.
right. Yeah, because it's been so bad for so long.
Hmm. Yeah, so you're basically on the very beginning of the protocol doing the binders. And like you said, you took the visual contrast, you failed it. So basically the recommendation is to stay on the fish oils and the binders until you can pass that visual contrast, which that will tell us that inflammation in that optic nerve in the brain is going down. So
Yeah.
generally, once you pass the visual contrast and have been on the binders for a while, the next step in the protocol is doing a nasal swab for Marcons, which is an acronym for basically a super bug that can create a biofilm in your nasal passages. So once you pass the visual contrast, I can ship you the nasal swab. And if you have the Marcons, that is often associated with that low MSH. And once again, if that MSH is low, it's going to cause sleep problems, chronic pain, hormonal abnormalities, chronic inflammation. A lot of people get sick a lot. And according to Dr. Shoemaker, if we test and that Marcons is positive, we can put you on a treatment protocol to eradicate that Marcons, and then that will further decrease that brain inflammation and hopefully increase the melanocyte stimulating hormone to resolve even more of the symptoms. And then
Yeah.
basically after that, there's a couple other steps, but basically what the experts are recommending now, once you get rid of the Marcons, you can jump up to VIP, which is a compounded nasal spray, vasointestinal polypeptide. And that is really where I see a lot of patients. They say it's almost like the lights come on. It's actually been shown to regrow parts of the brain and really help with the cognitive stuff. So basically, it's removal from the toxins, get on the binders until you can pass the visual contrast, zap the Marcons, and then the last step is the VIP. And according to Dr. Shoemaker, most people only need to get out of the environment and take the binders. But if we're still not getting resolution of symptoms, then we'll move on to the Marcon swab and do the compounded VIP. So that's basically the protocol in a nutshell. So I just want to thank you for your time. Do you have
Yeah.
any last thing to add about this?
Yeah, no, it was just interesting what you were saying about the optic nerve. Whenever I did do my treatments, different acupuncture, and I had a handful of different practitioners that I saw just to keep me going. Nothing was curing it, but I would always notice it visually. I'd walk out and I'd be like, wow, this is the most beautiful day ever.
Uh-huh.
So that is kind of interesting that when I was helped, I could notice a difference visually right away. So,
And just something I thought about with the visual contrast. So I know it kind of sounds not legitimate, but the visual contrast study was developed about 50 years ago for United States fighter pilots. So it is a validated study. It's been around for a while. And a lot of people, they may have like normal vision where they can see most things okay, but it's really the details, the visual acuity. So it's looking at fine details is what that test is testing for. So once again, you can go to survivingmold.com. You can do the questionnaire on there. You can also take the visual contrast. If you have most of the symptoms and fail the visual contrast, then there's about a 98% chance that we are dealing with CIRS, also known as chronic inflammatory response syndrome. And if that's the case, make an appointment with me. We'll draw the labs and then we'll get you going on the protocol. So yeah, I think I hit on everything. Anything else you want to add?
No, it's great. Thank you. I hope that other people can discover this and get some relief like I have.
Awesome. All right. Thank y'all for watching.